My name is Angela Oseyomo. As you can see on my ID, Angela Oseyomo. I'm going to be doing my critique on medication. The medication I'll be using is acetaminophen. First, I'm going to state the drug knowledge, starting from the classification. The classification of acetaminophen is antipyretic and non-opioid analgesic. Side effects, there are so many side effects. I will mention few: rash, nausea, or renal failure. Onset, 30 minutes to an hour. Peak, 1 hour to 3 hours. Duration, 3 hours to 8 hours. Health teaching, I will advise my patients not to take more than the recommended dose of 4 days. I will advise my patient not to take this medication with alcohol. More than 3 glasses of alcohol per day will increase the risk of liver damage. I will advise my patients to discontinue the use of acetaminophen if rash occurs and to notify the health professional. After that, I'm going to review the medication policy. I have reviewed medication policy and is understood. I will ensure that I follow the guidelines of this policy to give my medication. After that, I'm going to sign the signature sheet, starting from the date. I will print my full name, Angela Oseyomo, my status, practical nursing student, my signature, and my initials. After that, I'm going to verify ma with doctor's order. This is my ma, and this is my doctor's order. Starting with the patient name: Gallon Seed. Patient identifier number 344316. 344316. Date of birth 11/08/1965. Date of birth 11/08/1965. Allergy: codeine, penicillin. Allergy: codeine, penicillin. Medication: acetaminophen. Medication: acetaminophen. Dose: 650 mg. Dose: 650 mg. Route: PO oral. Route: PO oral. Frequency: every 6 hours. Frequency: every 6 hours. Time: 1200. Time: 1200. Special instruction: take this medication as needed for pains for 4 days. Take this medication as needed for pains for 4 days. After that, I'm going to talk about patient history. Patient is 55 years old. Patients have below the knee amputation. Patient is allergic to codeine and penicillin. I will talk about the drug contradiction. Earlier on, when I did assessment on my patient, I did my patient vitals, which were normal. I checked my patient's lab test. The lab results were okay, were normal. There is no contraindication. Patient stated that he's taking other medication, and when I reviewed the medication with the one I'm going to give, it was okay. There will be no contraindication. Patient stated that he's on pains, and I asked patient on the scale of 1 to 10, 1 be the lowest, 10 be the highest. Patient stated he's stated 7. So that's the reason why we're going to give patient medication to reduce the pain. So at this point, I'm going to do my hand hygiene. After my hand hygiene, I'll bring out my medication, and I will verify that my medication is not expired. This medication, the expiring date is June 2022. After that, I'm going to do my first check to verify the man with the bottle in my hand. First check, starting with the patient's name. Galamsey, Galamsey. Medication, acetaminophen. Dose, 650 milligram. Dose, 650 milligram. Route, PO oral. Route, PO oral. Frequency, every 6 hours. Frequency, every 6 hours. Time, 1200. Time, 1200. Site by mouth. Site by mouth. Reason to reduce pain. Reason to reduce pain. Immediately, I will do my second check. Patient name, Galamsey. Patient name, Galamsey. Medication, acetaminophen. Medication, acetaminophen. Dose, 650 milligram. Dose, although 650 milligram, but in my bottle is showing 325 milligram. Route, PO oral. Route, PO oral. Frequency, every 6 hours. Frequency, every 6 hours. Time, 1200. Time, 1200. Site by mouth. Site by mouth. Pain, reason to reduce pain. Reason to reduce pain. After doing my second check, I'm gonna do my calculation, which I will follow the formula. The formula is desire over available times quantity. So my desired dose right now is 650 milligram, and my available, as you can see, is 325 milligram. Over 325 milligram times quantity, which is 1 milligram. So I'll do my calculation. 650 milligram divided by 325 equals to 2. 2 times 1 equals to 2. So I'm going to be giving 2 tabs. So I'm going to pour my medication following the EPSIS. Those are my 2 tabs, and I will pour it inside my med cup, and I will cover my medication. So now I'm going to do the third check. My third check, starting with patient name, Galamsey. Medication, acetaminophen. Medication, acetaminophen. Dose, 650 milligram. My dose is 2 tabs. 2 tabs of 325 milligram. 2 tabs making of 325 milligram, making 650 milligram. Route, oral. Frequency, every 6 hours. Frequency, every 6 hours. Time, 1200. Time, 1200. Site by mouth. Site by mouth. Reason to reduce pain. Reason to reduce pain. After doing my third check, I will recalculate. Do my recalculation again by flipping the paper over. I will put down the formula: desire over available times quantity. My desire is 650 milligram. My available is 325 milligram. And my quantity is 1 milligram. So now I'm gonna do the calculation. 650 divided by 325 equals to 2. 2 times 1 equals to 2. So I'm gonna be doing 2 tabs. I'm gonna be giving 2 tabs, which is all I already have on main cup. So at this time, I'm going to call the tester to come and verify. The tester came, the tester already verified, and the tester agreed I'm going to give 2 tabs. Now I'm going to take my medication, put my medication away. So after putting my medication away, it's time for me to go give medication to my patient. So I will make sure I go with the inpatient sheets, inpatient face sheets to verify my patient. So As I'm going, I will also take water. I will also take water with me to give medication to my patient. So when I get to my patient's room, before I before I enter, I'm gonna do another hand hygiene. After doing hand hygiene, I will enter my patient's room and I will do introduction. Hello, Galoseed. My name is Angela Oseyomo. I'm a practical nursing student at Durham College. I'm here to give you your medication for your pain. Is that okay? Yeah, patient said it's okay. Patient gave me the consent to giving medication. So I'm going to verify my patient to be sure I'm with the right patient. Can you tell me your name, please? Galoseed. Can you tell me your date of birth? November 8, 1965. Okay, so I'm going to verify by myself by looking at the wristband. Patient name Galoseed. Patient date of birth is November 8, 1965. I'll ask patient, are you allergic to any medication? Patient specify he's allergic to penicillin and codeine, and it's stated on the wristband that patient is allergic to penicillin and codeine. Okay. So after that, I'm going to do my environmental check. I'm going to do my environmental check to be sure that everywhere is declustered. So I'll check my environment, I decluster everywhere, and then I will check to make sure all the equipment are functioning, the O2 stand, the suctioning machine, and I'll make sure all the machines are functioning. My machines are functioning. I've already opened them. They're all functioning. Now I'm gonna shake the bed to ensure the brakes are on. Yes, the brakes are on for patient safety. I will raise the bed to a working height position. I have raised my bed to a working height position. Opposite me, I'm going to raise the side rail up so that to protect patient from falling. And after that, I'm going to raise the bed to a fuller I'm going to raise the bed to a fuller position, and I will ask the patient if the patient needs to void, and the patient said they don't need to void. So at this time, I will ask the patient again, are you allergic to acetaminophen? Patient said he's not allergic to he's not sure if he's allergic to acetaminophen. Well, I gave another medication teaching to the patient about acetaminophen. The health teaching that I gave the patient is that I told the patient not to take this medication, not to take more than the recommended dose of the medication. I told patient not to take this medication with alcohol, and I told patient to discontinue the use of this medication acetaminophen when rash occur, and to notify the health professional. Patient understand, and now it's time for me to give patient the medication. So I gave water to the patient, and I gave the patient the medication. I ensure that patient take the medication. Like, I ensure patient swallow the medication, because earlier on when I did my assessment, I also check if patient can swallow medication. I found out that yes, patient can swallow medication, so it was okay for me to give him the medication to swallow. He swallowed everything. Now after swallowing the medication, I have to put the patient back to a comfortable position. I lower the bed, and I gave the call bed to the patient, and I let the patient know I'm within the reach. If she needs me, she should ring the bell. And then I sign my mark sheets. I signed my man sheet under 1200. And I call my co-assigners to come and sign. The co-assigners came and also signed under 1200. Like, also signed under 1200. And then I did my last hand hygiene. And I left the room.